Miss West, Mohammed here. So this is my take on the internal systems application assignment, and the topic that I chose was angioplasty. So angioplasty is the procedure which is used to restore the blood flow in the narrowed and blocked coronary arteries caused due to plaques or blood clots. Angioplasty can also help reduce the amount of symptoms for chest pain, shortness of breath, and blocked arteries. And there are mainly two types of angioplasties. The first one is called the balloon angioplasty, which involves a balloon-like structure attached to a needle, and the second one is called the coronary stent angioplasty, which also involves a balloon and a needle, but it's covered with a wire mesh. And you can see that this is an example of coronary stent angioplasties, and we will discuss both of these angioplasties further on in the presentation. So now if you were to talk about the main purpose of angioplasty, which is to restore the blood flow in the narrowed and blocked coronary arteries caused due to plaques or blood clots. And when plaques or blood clots form around the walls of the coronary artery, it can result in something called the coronary artery disease, or CAD for short. And following this, angioplasty can also help restore the blood flow in the heart without the need for an open heart surgery. And angioplasty is also often used as a quick way to open blocked arteries during a heart attack. So the main procedure for an angioplasty surgery goes as following. Once the patient is admitted, his heart is monitored and is given an intravenous sedative to relax the body. Then a needle is inserted through the wrist and into the radial artery, where then a guard wire is passed through the arterial system up to the heart. After that, a catheter is inserted into the body through the guard wire, which is monitored using an X-ray device called a fluoroscope. And it eventually then makes its way up to the heart, where it then detects the blockage. And after detecting the blockage, it then a flexible guard wire is then inserted into the artery vessel, followed by a balloon tip catheter, which then places itself on the side of the blockage. And after it positions itself on the side of the blockage, it then rapidly starts inflating and deflating to push the vessel wall outwards, re-establishing the flow of blood in the artery. And after the blocked vessel is reopened, the deflated catheter is withdrawn from the artery. And the same procedure may be repeated in the case of multiple blockages, or any blockages in the future at all. And now some patients may also receive something called the coronary stent angioplasty, which I also mentioned in the intro, which looks something like this. And during coronary stent angioplasty, after the catheter has positioned itself on the side of the blockage, it then inflates, expanding the stent and locking itself in place. And the deflated catheter is then withdrawn, leaving the expanded stent behind to open the artery permanently. As you can see in this picture, after the needle and balloon has placed itself on the side of the blockage, it then expands one time, and then the balloon and the needle is withdrawn, and the wire mesh is left inside the artery permanently. And now in mechanism, I just remembered that if I were to describe these three pictures in a little bit more detail, so then it would be that this is the part where the needle is inserted into the radial artery, and this is the part where after the needle reaches the heart, it detects the blockage. And this is the part where after it detects the blockage, the needle and the balloon tip catheter makes its way into the affected area and it positions itself. And now after this step, you know that the balloon starts inflating and deflating, and after it starts inflating and deflating, it reduces the plaque or the blood clot, allowing more blood to pass through. So now if you were to talk about the second last slide in the presentation, and probably one of the most important slides in the presentation, because in this slide I'm going to tell that why I think angioplasty as a tech relates to our unit for internal systems. So to start off, coronary arteries are responsible for carrying the oxygenated blood to the heart muscle itself, And angioplasty is basically the tech which is used to unblock those coronary arteries. And now if I were to give the proper definition, or if I were to describe like this whole relation between angioplasty and our units for the internal system, it would go as following. Basically, angioplasty relates to the unit of circulatory system which we covered, because it involves the process of restoring the blood flow in the coronary arteries, which is a major component of the heart. And as we know, the heart is a vital organ in our circulatory system, and as the circulatory system is one of the system which we covered in our internal systems topic. And now to finally talk about my last slide, which is on why I think more people should invest in angioplasty. So first of all, angioplasty is a fairly safe procedure with more than 1 million being performed in the US alone, and the time taken to perform the surgery is also fairly short, from 30 minutes to a few hours. And second of all, angioplasty surgeries have a very high success rate of over 90%, which means that 90% of the patient which have the surgery are cured, but around 30 to 40% might have to have the surgery again in case of another blockage in the artery. And finally, coronary angioplasty is a fairly cheap option if you're living outside of the US, because the cost of a single surgery in the US is around $32,000, but in countries like Switzerland and Netherlands, it can go as low as $6,400 to $7,400. And so this rounds up my internal systems biological assignment. And oh, I just noticed I spelled assignment wrong. Um, and so this is my actual last slide for MLA Works Cited, and I actually numbered the websites which I used, and you can see that I used the numbers over here. And for the things that I didn't use the numbers, those were mostly the things which I came up by myself or from my own research. I didn't take them from the website, and also the things that I took from the website, I tried to paraphrase them as much as possible, just to make it not like I just copy pasted them. And so yeah, Mr. West, this was my internal systems assignment. I hope you liked it, and I would be very excited to have some feedback. Thank you so much. Have a wonderful, wonderful day. Bye bye.